Hi, this is Euthanasia News, and I'm Maria Plazinski.
And I'm Julia Brown.
And today we are here to talk to you about euthanasia.
What you do and do not know. So Maria, what exactly is euthanasia?
Well, Julia, euthanasia is the process of painlessly helping a terminally ill person to die. It's also known as assisted suicide or mercy killing, but in most countries it is illegal to do so.
So you mentioned that euthanasia is similar to assisted suicide and mercy killing. What exactly is the difference then between euthanasia and assisted suicide?
Really good question, Julia. Assisted suicide is when the person who dies performs the last act. And this is when the doctor only helps the patient try to terminate his or her life.
Oh. There are actually a few types of euthanasia also.
What are those types, Julia?
Well, one we would call passive versus active. And passive euthanasia is deliberately stopping aggressive medical treatment to ultimately result in death. While active euthanasia consists of causing a person's death by slowly poisoning them in any way, shape, or form. So, to make this simpler, you can think of what the Catholic Church calls a sin of omission and a sin of commission. A sin of commission is doing something to cause a sin, whereas a sin of omission would be not doing something that results in a sin, like not going to church on a Sunday. So, by not helping someone live or letting them die, that would be considered passive euthanasia. Active euthanasia is actively killing them. Another thing that comes up a lot frequently with the subject of euthanasia is PVS, which is persistent vegetative state. So what exactly is persistent vegetative state?
Well, persistent vegetative state, or PVS, is when after a patient is in a coma or a serious head injury, they lose their knowledge, their thoughts, and their senses. And they don't, do anything on their own. It's all involuntary actions.
So it has been classified in the past as people saying that a person in PVS would naturally be called brain dead, which is actually false because when you are in a vegetative state, the lower part of your brain is actually still functioning and natural and healthy. So we talked about the involuntary actions that they cannot function with in PVS. What are the actions that they can do, if any?
Well, they can move their eyes around like following an object. They can smile. They can, they actually have normal circulation. They have normal sleeping patterns, like waking up and then sleeping. And they can their limbs can move, but it can't be on command, or they can't even hold them up, but they can move, so.
Like a finger twitch or something like
yeah.
that? Oh, and they can also breathe, right?
Yeah, they can breathe.
On their own.
On their
which
own.
is awesome.
So, Julia, what are the causes of PVS?
Well, there are many, but some of them include genetic disorders, a serious head injury, most commonly, seizures, stroke, tumors, cancerous tumors, and also meningitis, and many other diseases can cause PVS.
Thank you. So, Julia, what happens to your body during PVS?
Well, many things do actually, but one major thing is that the lungs ultimately collapse. And it is hard for the lungs to secrete what should be going in and out of them, which can sometimes lead to pneumonia and other diseases that happen to do with the lungs. So that's a very serious side effect. The muscles also waste away, kind of deteriorate, along with the skin, which breaks down. And most of the time you will obtain ulcers during PVS.
Thanks.
So obviously we know that PVS is a very serious medical condition. Are there any treatments or cures to bring a person out of PVS?
Unfortunately, there's not any treatment or cures. Well, actually, I'm sorry, no cures. Treatment is just making them comfortable. And healthcare providers, that's their main goal. Now, sometimes while there's a PVS patient, they can just awake suddenly, within the first month. That's always surprising.
Now over to Megan and Bianca to learn what involuntary and voluntary euthanasia are. Thank you.
Thanks, Maria and Julia. Just like all things in life, it's different to volunteer than to be volunteered, which can help explain voluntary and involuntary euthanasia. So, we might ask, what is voluntary euthanasia? I'm not as informed on involuntary and voluntary as you. Why don't you tell us about it? Okay, well, voluntary euthanasia is when the patient actually volunteers themselves to deliberately take their life. They are fully informed of what they're doing and they are asking to take their life. While involuntary is where the patient doesn't really have consent of what they are doing because they're unable to think for themselves or something of that matter. What I do know about involuntary and voluntary euthanasia is that those people that are affected by it are children, senile, mentally retarded people, people in comas, and old people.
Wow. Euthanasia is a very controversial topic, and many times when people have to undergo the process of euthanasia, they have to think about many things when determining their decision because there are many upsides and downsides to euthanasia.
Some of the pros that people look at are putting a sick person out of their misery. When somebody is going through the process of euthanasia or is about to go through the process, the family has to think about the patient and where they ideally will be happier. If they are suffering, they usually think that they're doing the person a favor by putting them out of their misery because they're suffering. Another thing that is a pro of euthanasia is it is also sort of legalizing murder because you are, in the end, killing the person. Also, one of the main factors that is a huge controversial topic on euthanasia is the expensive aspect of it because life support is very expensive and in our economy these days it is very hard to pay for it. So the family in a sense can be relieved of all of the payments that they have to pay for life support, which is just another key aspect of it.
Now for the cons. It is taking a life, and also in some countries it may be legalized, but killing is ultimately wrong. Although euthanasia affects the ill person, it also affects others, including families and friends.
Now, here are some interviews on different perspectives and aspects of euthanasia, including the Catholic perspective.